Hello, I'm very grateful to the Fondazione Prada for giving me the possibility to participate in these conversations on the human brains. As you know, the brain is composed of a right and the left half called hemispheres. Each hemisphere controls the opposite side of the body and of the external space. So the left hemisphere controls the right space and the right hemisphere mainly controls the left space. The two hemispheres are grossly similar, but they don't have the same role for some cognitive abilities. For example, in most of us, the left hemisphere is important for language, to speak and to understand language, and to control the right dominant hand. However, today, I would like to talk about the other hemisphere, the right hemisphere. Let me start by presenting the case of the great Italian film director, Federico Fellini. In April 1993, Fellini received his 5th Oscar for lifetime achievement. A few months later, he unfortunately suffered from a stroke in his right hemisphere. So he could not move anymore his left hand and his left leg. And he started producing funny drawings like this one. Fellini was a very talented cartoonist. But as you can see, the drawings lack some details on the left. Some details on the left part of the drawings are missing. This is how he imagined his therapist ordering him to draw her. When Fellini had to mark the central point of a horizontal line, he deviated the midpoint towards the right side and even added a few funny drawings on the right part of the line. So it is as if he didn't pay attention to the left part of the line. So one might think, well, perhaps he didn't see the left part of the line, but this was not the case, because sometimes he even drew over the left part of the line, but then his subjective midpoint was always deviated towards the right, perhaps because the weight of his attention stayed on the right extremity of the line. So the case of Federico Fellini, unfortunately, is by no means unique. About half of the patients with a stroke in the right hemisphere present signs of visual neglect, of left neglect. So they do not eat from the left part of their dish. They do not shave or make up the left part of their face. They do not respond if asked questions from the left side, or else they respond to somebody else who happens to be on their right side. So you can easily imagine how disabling this condition is, because patients they are not patients with neglect. They are not able to resume everyday activities. So here you can see a patient we observed at the Salpêtrière hospital. We asked him to cancel, to mark all the small lines on the sheet. And as you can see, he only paid attention to the lines on the right part of the sheet and completely forgot to mark the lines on the left part of the sheet. There is also a typical behavior which stresses the problems that these patients have with attention. If you try to assess the patient's visual fields by raising your hands in the two visual fields of the patient and asking the patient to look at your nose, and then briefly wiggling the fingers of one or the other hand, and asking the patient whether he sees the movement or not. Well, this can be impossible with some neglect patients, because as soon as you raise your hands in the visual fields of the patients lose fixation and immediately look at the hand on their right, as if this right-sided stimulus exerted a sort of magnetic capture on their gaze and attention. But what are the critical circuits in the right hemisphere whose damage provokes left neglect? To answer this question, some years ago, we had the possibility of using direct brain stimulation during neurosurgery. When neurosurgeons operate brain tumors, they obviously don't want to leave patients with neurological deficits. So sometimes they awaken the patient during the intervention, and the brain has no receptors to pain, and they briefly inactivate with electrical stimulations the regions of the brain they would like to take away. So if the patient shows deficits, stops talking or moving, for example, the hand controlled by that region of the brain, then the surgeon respects that region. And so we asked a patient who were being operated of a tumor in his right hemisphere simply to bisect lines. It's the line bisection test we saw earlier. What we discovered is transitory inactivation in one particular region of the brain provoked the largest rightward deviations in line bisection, so signs of severe neglect. And it was this region at the bottom of the surgical cavity that you can see here. And this region corresponds to this structure, which you see here in blue, which is a system of connections in the brain white matter, which connects the posterior part to the anterior part of the brain. It's a kind of a highway, a big chunk of cables, which allow the posterior part and the anterior part of the brain to communicate with great efficiency and with great speed. You can see this pathway here in cyan in this figure. And we know that this pathway is important for visual attention. When this pathway is damaged in the brain, in the right hemisphere, then patients show signs of left neglect. They do not pay attention to the left part of the world. Importantly, neglect, however, is not symmetrical, because similar lesions in the other hemisphere, in the left hemisphere, very rarely produce signs of right neglect. So there is really something special in these networks, these attention networks in the right hemisphere of the brain. So we don't know yet what exactly happens in the brain of patients with neglect. One possibility is that the left healthy hemisphere plays a role in neglect signs. The left hemisphere is not very good in controlling attention. And so when it is left alone by a lesion in the right hemisphere, it could provoke signs of neglect. For example, in this study, we used a non-invasive neuroimaging technique called magnetoencephalography to study the activity in patients, the brain activity in patients with signs of neglect. We asked patients with right hemisphere damage and left neglect to press a button each time they saw an asterisk, which could occur on the left side or on the right side of the screen. Being patients with neglect, of course, they did not respond to all the left-sided asterisks. What we discovered is that just before this omission of responses to left-sided asterisks, so a left-sided asterisk was presented and the patient did not respond to it because it neglected it. Just before the asterisk was presented, there was this activity in the anterior part of the left undamaged hemisphere. You can see here in red. So this activity in the healthy hemisphere preceded actually signs of neglect, as if this region of the left hemisphere was saying, whatever it happens next, you don't have to respond to it. Perhaps this region actually oriented patients' attention towards the right side so that they could not respond to left-sided stimuli. So it could be that the left hemisphere actually has a negative role in neglect, at least for some signs of neglect. But can the left hemisphere learn with time to control attention, special attention in a more balanced way, and so to compensate for neglect? To answer this question, we need to take into account another important dimension, which is the evolution of neglect in time. We know that some patients with neglect eventually recover, at least partially, from signs of neglect. Even Federico Fellini, a few months after his stroke, could draw more symmetrical figures, images, than he did in the acute phase of his stroke. So to assess this hypothesis, the hypothesis of a possible role of the left hemisphere in neglect recovery, we followed up in time 45 patients with right hemisphere strokes and signs of neglect. We tested these patients for neglect twice, once at around 3 months after the stroke, and the second time we tested them after more than 1 year from the stroke, so in a very chronic phase. We saw that of these 45 patients, 27 had signs of neglect at 3 months from stroke. Of these 27 patients, 10 had recovered after 1 year after the stroke, and 17 still showed signs of neglect 1 year after the stroke. And when we compared the lesions, the anatomy of the lesions in these patients, we discovered that the most important difference was in another white matter pathway, in another big chunk of cables, which is called the corpus callosum, and it allows communication between the two hemispheres. So those patients who had damage in fibers who led to what you can see in the figure in red, to the posterior part of the corpus callosum, these patients did not recover from neglect. They kept showing signs of left neglect more than 1 year after the stroke. On the other hand, patients who had this structure in good anatomical shape could eventually recover from neglect. What does this mean? It means that probably the left hemisphere, with time, it can learn to compensate for neglect, but only when the healthy left hemisphere can talk to the damaged right hemisphere through this portion of the corpus callosum. And by reviewing the literature, we discovered that this compensation by the left hemisphere can actually be a general mechanism of recovery from cognitive deficits after stroke. For example, in the literature, there are descriptions of patients with this time left hemisphere damage and language disorders, patients who could not speak anymore or who could not anymore understand language after lesion to the language circuits in the left hemisphere. Then these patients, some of these patients were recovering from their deficit, but unfortunately they got a second stroke, this time in the right, previously healthy hemisphere. And after the second stroke, they lost the ability that they were recovering. So this compensatory activity of the healthy hemisphere after unilateral stroke could be a general mechanism of recovery from cognitive deficits after unilateral strokes. Now, the challenge for future research is to try and find ways to improve the communication between the hemispheres in stroke patients in order to shift the state of interhemispheric interactions from a competition state, which we can see in the acute phase of the stroke, to a cooperation state, which may promote recovery from the cognitive deficits that patients can experience after a stroke.